Hello everyone, this is the video demonstration of mini mental state examination and Montreal cognitive assessment. First, we will watch the mini mental state examination, MMSE. This is the purpose of MMSE. This is the administration procedure for this assessment, and equipment required are score sheet that demonstrate figure to copy, paper, and pen. The components of this assessment are orientation, recall, language and practice, registration, attention and calculation. Assalamualaikum and hi.
Waalaikumsalam.
Well, thanks for being here. How are you today?
Right.
Okay, today we are going to do an assessment that we call MMSE assessment. This assessment is to assess your memory and thinking. So I have a series of questions for you to answer, but just do your best and make sure you hear my instruction. If there are any question that you didn't understand, please ask me. And there is not really time for you, so you can take your time and make sure you understand the question, okay? The first area is orientation that have 10 points, 5 points for time orientation. Trapeze asks the patient for the year, seasons, date, day, and month, while the other 5 points for place orientation. Ask intern, where are we in? The state, the country, the city, the place, and the floor. 1 point can be given for each correct answer. Can we start now?
Yes.
Alright, for the first question, what is the year right now?
2021.
And what season?
I don't know.
The date
20.
and the day is?
Monday.
And what month?
May.
Okay. Next, what state are we in?
Sepang.
In what country?
Malaysia.
What about the city?
Putrajaya.
And what is the name of this place?
Hospital Putrajaya.
We are on what floor?
2.
Alright. The second area is registration, which have 3 points, 1 point for each correct answer. The therapist say the names of 3 unrelated objects clearly and slowly about 1 second apart. Then ask the patient to repeat them. First repetition determines the score. Keep repeating the items as many as 6 times until the patient can repeat all 3 of them. Don't forget to record the number of trials. Then, therapist tell the patient to remember the words because the words will be asked again shortly. Now, what I'm going to do is, I'm going to name 3 words for you. I want you to repeat the words after me. And then, I want you to remember the words as I will ask again in a little while. Okay? Apple, table, ball.
Apple. Table. Ball.
Okay, good. The third area is attention and calculation that have 5 points, 1 point for each correct answer. The therapist asks the patient to begin with 100 and count backwards by 7. Stop after 5 subtraction and score the correct answer. If the patient cannot do calculation, we can do alternative form. The therapist will ask the patient to spell word backwards. Then, the score is the number of letters in correct order. Now, I will let you to count backwards from 100 by 7.
93. 86. 77. 73. 68.
Okay, can you please spell word backwards?
D O R L W.
Okay, good. The fourth area is recall, which have 3 points, 1 point for each correct answer. Therapist asks the patient to recall the 3 objects previously asked to remember, which from the registration part. Earlier, I told you the names of the three things. Can you tell me what those were?
Apple, ball, chair.
Alright. The last area is language and praxis, which have 6 items. The first item is language, which have 2 points, 1 point for each correct answer. Therapist show to the patient 2 simple objects such as wristwatch and a pencil. Then ask the patient to name the objects. Now, can you tell me what is this?
Pencil,
And this?
wash.
Alright. The second item is repetition, which have 1 point. Therapist ask the patient to repeat the phrase. No ifs, ands, or buts. Make sure allow 1 trial. Now, can you repeat this phrase? No ifs, ands, or buts.
No, ends, or but.
Okay, good. Item 3 is complete 3-stage command, which have 3 points. 1 point for each correct answer that is performed correctly. Give the command and ask the patient to perform the command. The command is, take the paper in your right hand, fold it in half, and put it on the floor. Okay, we move on to the next question. Now, I want you to listen to my instruction. I want you to take this paper by your right hand and fold it in half and put it on the floor. Okay, good. For reading item, print clearly on a piece of paper in a large letter the command, close your eyes. And then ask patient to read and do what it says. 1 point can be given if the eyes are closed. Alright, now can you please read this and do what it says?
Close your eyes.
Okay, good job. You can open your eyes now. Next item is writing, which have 1 point. Provide a blank piece of paper and ask the patient to write a sentence about anything. 1 point can be given if the sentence contains noun and verb. Punctuation does not matter for the purpose of scoring. Okay. Alright, now I want you to take this pen and I want you to write a sentence about anything. Okay. The last item for this area is copying, which have 1 point. Therapist ask the patient to copy the picture on a piece of paper. 1 point can be given if all 10 angles present and the 2 figures interact. Any rotation of the figure or tremor is ignored. And for the last, can you please copy this picture on this paper? Okay, thank you. The result of this assessment showed that the patient's score is 21/30, which means the patient are at the level of mild cognitive impairment.